Hi, my name is Lisa.
Hi, my name is Pramila George.
Hi, my name is Morgan Pedersen.
Hi, my name is Irina Gonzalez.
I'm Sarah Tabbitt.
My name is Yesenia.
I'm Wendy Friedman, and I'm 37 weeks pregnant.
I'm currently 31 weeks pregnant, and I'm also a family medicine physician.
I'm currently 29 weeks pregnant.
Almost 39 weeks pregnant.
29 weeks pregnant.
10 weeks pregnant.
I'm about 20 weeks pregnant.
During this COVID-19 pandemic, being pregnant and also being a physician has been quite an experience, to say the least. There have been a lot of emotions and a lot of different feelings that have been going on to an already stressful period.
Being in my first trimester, one of my biggest concerns health-wise was coming down with a fever. And now with the increased prevalence of COVID-19, that chance is much more likely. The problem with coming down with a fever in your first trimester, it can lead to birth defects. It can potentially lead to loss of pregnancy if the fever is not controlled.
My husband still has to go into work because his company is considered essential, and it really has me stressed out. I think the biggest worry for me is that, you know, he will get sick and not be able to be there at the birth of his child. Even worse, really, that I will be also get sick and, you know, be separated from the baby.
Even stepping into a hospital is terrifying right now. My last visit into the hospital, I had to go through screenings, wear a mask. It just changed everything from being beautiful and a celebration to almost just like a fear and just being kind of terrified to even go through with it.
My doctor says that there isn't really a concern for the baby. There hasn't been any evidence that shows that I can pass, if I got sick, that I would pass the virus on to the baby.
There's not a lot of information right now about how this virus impacts pregnancy, but from what we do know, it seems like there are some good outcomes, and there have been a few, right? Because the research is limited, a few healthy babies delivered to moms who've had COVID-19. So that makes me feel good. As of right now, really fortunate that both my husband and I are able to work from home, but our daycare is closed. So we're working from home with a 2-year-old, which is a little bit stressful. The days are just really long, especially since we can't really get out of the house.
It came to a point where I started to worry when I saw patients with these COVID-like symptoms on my schedule. And I was, stuck between, should I see them? Should I ask my colleagues? I don't want to dump this on my colleagues. And, when I spoke to them about my issues of seeing the patients, being pregnant especially, they were very, very understanding. And I even had some of my colleagues just come up to me and say, hey, listen, you're not going to see that patient. I'm going to go see that patient. You just stay in your office. Today, I actually just had it was my first telephone OB visit. And it was nice to speak to my OB over the phone, discuss all the issues that I had. We were able to discuss changes to the birthing plan, any way that this COVID-19 can affect future visits and so on. So I was able to get a lot of information. However, a part of me during the visit just really wished I could have that Doppler on my belly checking her heartbeat. The next appointment that I'm due for, I actually have to see the OB for certain tests to be done. So I will be seeing my OB in about 1 month, and I'm hoping that the pandemic is better at that time, or at least somewhat controlled, so that I can make the visit. But just that comfort of knowing that, okay, if I call her, she'll be able to fit me in next week and I can see her, or even later this week. But now with COVID-19 is not there, it's going to be over the phone reassurance, and it's very frustrating. It can be very scary.
So I think it's really hard to do the prenatal appointments virtually, because at this point in the pregnancy, my doctor needs to check on the baby and see, what the status is. So I have to go into the doctor's office. And I actually also have to go to the hospital once a week because I have gestational diabetes. I do feel very nervous going, but I know that they're taking a lot of safety precautions.
I was really trying to be open to the possibility that it might not go according to plan because every birth is different. And I feel like with this coronavirus pandemic, that is really putting that to the test, right? Like everything feels very out of control, right? Versus just a few smaller factors that may have been on my mind the first time around. So I don't actually have a birth plan. I don't know if that's all second child problems. I was open to an epidural. I still am. I am worried about the availability of an anesthesiologist or just the extra support staff on the labor and delivery ward. This is totally just in my own head, not anything my doctor told me I should be worried about. But I think I was also worried about that in general, like what happens if I'm too far along or don't get to the hospital in time for an epidural. So that is low down on my priorities. I think I could do it without one. I know I can, but it just definitely makes you rethink. And then for me, having a 2-year-old at home, it's definitely throws a wrench in the who's gonna watch your kid when you go to the hospital to have birth. At the end of the day, just trying to stay calm and have a healthy baby.
I've talked to my OB about possibly having an induction, which is something I was completely against just weeks ago. We haven't really decided to go down that route yet, but I think that considering with everything else going on, I'm a lot more open to maybe just trying to have this baby as soon as possible. I don't want to take any drastic measures, but I think that weeks ago I was very against, having medical interventions. I just wanted to give birth naturally without pain, and now I've pretty much changed my tune.
I'm actually giving birth in Greenwich, Connecticut. So far, I haven't heard about partners not being allowed in the delivery room. So my husband actually just brought that up this morning. He said that, what if I'm not even allowed to be in the room when the baby's born? What if I can't cut the umbilical cord? And that hadn't even crossed my mind. And that's kind of scary.
I know a lot of people have reached out and talked about maybe doing a home birth, but right now, midwives, it's impossible to find one, even if you wanted to. I feel like I need to be in a hospital, especially with my placenta situation. I didn't realize I would need a C-section because right now, where it stands, the baby physically can't come out because the placenta is on top of the cervix and blocking it. So I need to be in a hospital to deliver. I have to make sure I'm in the care of someone if I have to go into surgery. And that alone I thought was terrifying before all of this happened. But now I'm almost begging for a C-section because that would be something to schedule and to plan around.
I just want like a safe birth, and I just want my husband to be there. Like, that's the most things I ask for right now.
I hope, I believe that there are going to be so many beautiful babies born during this time, and you're stronger than you think you are, and you can do this.
Women have been giving birth through so many different world disasters, through different other pandemics, epidemics, world wars, even tsunamis, hurricanes, earthquakes. And women have done it, and they've been successful, and so many beautiful, healthy babies have been born, and we can do it too. It's a bit of a struggle, and yes, it may have been easier for others who did not have to go through COVID-19, but we can get through this too, and we will get through this.
To be able to look back and think like, I was pregnant during that time, or I brought a baby into the world during one of the craziest times, is pretty powerful. And like right now it's really hard, but I think we'll look back and it will only make us stronger. It'll make us better mothers because we're like, okay, if we can get through that, everything else is just gonna feel so minimal.
I'm really looking forward to meeting my baby. That's what I try to focus on, is meeting him and saying hi, and then protecting the crap out of him.